Hello. Hi.
Hi.
All right. My name is Elaine Daniels, and I will be your nurse for the day. Is it okay if I perform a head-to-toe assessment on you?
Yes.
All right. So to start, I'm gonna go wash my hands. I'll be right back.
Okay.
Come on, I go wash my hands. To start off, I'm going to grab a paper towel, turn on the faucet. I'm going to rinse. Then I'm going to apply some soap. I'm going to wash my hands for 30 seconds. Make sure I get all in there. Make sure I scrub my fingernails. I'm going to wash my hands for 30 seconds. Alright, then I'm going to rinse. Alright, then I'm going to dry. I'm going to pat dry as I go up. Pat dry up to my wrist. Alright, I'm going to throw this in the garbage. And I'm going to grab another paper towel to close the sink. Alrighty. Okay. Your name and date of birth, please.
Dr. Incra 81102.
I'm just gonna check your wristband to confirm. Alright, that seems about right. Can you tell me if you've been feeling any pain?
Yeah.
Can you tell me where exactly the pain is?
My lower back.
Is there anything that you do to make the pain feel better or worse?
Just rest and lay down.
Okay. From 0 being no pain and 10 being the most pain you ever felt, can you put it on that scale and tell me how bad you feel?
Like 8.
8? Oh, okay. Have you been feeling any numbness or tingling in your body?
No.
Okay. Can you tell me what year we're in?
2022.
Can you tell me the season?
Winter.
Can you tell me the president?
Joe Biden.
And what exactly place you are?
The house.
Okay. Patient is alert and oriented, ×4. Alright, I'm going to inspect and palpate patient's head. I'm going to don gloves. I'm going to inspect, check for any bruising, any cuts, any lesions, any abnormalities. Patient is normal. Then I'm going to go to patient's ears. I'm going to inspect and palpate. Alright, then I'm going to check her tympanic membrane. So I'm going to pull the pinna up and back. I'm going to check her tympanic membrane. It is pearl, it's gray. There is no drainage. I'm going to do the same to the other side. I'm going to inspect and palpate her ear. Then I'm going to pull the pinna up and back. Check her tympanic membrane. It is gray. There is no drainage. I am going to move on to her eyes. Patient's sclera is white. Can you please put on your eyelids for me? Patient's conjunctiva is pink and moist. Patient's pupils is equal to round. Reactive to light. And can you please follow my pen? And eyes are accommodated. With your figure, can you please hold one nose and breathe in and out? And do the same to the other nose, please. Alright. I'm just going to check patient nose for any cuts, any drainage. There's no cuts, no drainage. Patient's nose is midline and symmetrical, as well as her septum. It is midline. Her lips are pink and moist. Can you say ah for me? Alright. Patient's tongue is pink and moist, as well as her mucous membranes is pink and moist. Teeth is intact. I'm going to check her JVD. I'm just going to there is no bulging. I'm going to do the same on the other side. There is no bulging. I'm going to palpate softly on your lymph nodes. It's not palpable and there is no bulging. I'm going to check her clavicle for any tinting, any signs of dehydration. There is no signs of dehydration and there's no tinting. I'm going to ask patient, can you please, push your shoulders up? All right, that's good enough. Patient is strong and bilateral in both shoulders. Can you please put your arms out for me? And can you rotate your wrist and then bend your arm back and forth? All right, patient range of motion is normal on both sides. With your hands, can you I'm gonna push down on your hands. All right, and then I'm gonna ask you to push down on my hand. Patient is strong and bilateral in both hands and arms. Can you just pull down on my? All right, patient's strength is strong and bilateral in both hands. I am going to move on to her lung sounds. I'm going to first start with her posterior lung sound. So can you please turn a little bit for me? I'm going to inspect and palpate. There's no cuts, no abnormalities. And now I'm going to auscultate. Can you breathe in and out for me? In and out. In and out. In and out. And in and out. And one more time. Okay, patient's posterior lung sounds is clear. There's no rales, no rhonchi, no wheezing, no crackles. Now I'm going to check patient's anterior lung sounds. Okay, I'm just going to inspect and palpate. Inspect, there's no cuts, no abnormalities, no bruises. Okay, now I'm going to auscultate. I wouldn't let my thing swing like that, but all right, I'm gonna ask you to breathe in and out for me. Okay, patient lung sounds is clear. Anterior lung sounds are clear. No rales, no rhonchi, no wheezing, no crackles. I'm gonna ask you if you can please, can I see your hand one more time? I'm just gonna check patients for capillary refill in all her fingers. Okay. All right, there's no clubbing and patient's capillary refill returning in 3 seconds. All right. I'm going to move on to her heart sounds. So, to start, I'm going to start with the aortic valve. It's the right second intercostal space. I will listen for a whole minute. Same as the lung sound, I will listen for a minute. I hear the S1, S2. Now I'm going to move on to the left, the pulmonic second intercostal space. Lub dub is heard, S1, S2. I'm going to move on to the third intercostal space, which is the Erb's point. S1, S2 have been heard. I'm going to move on to the tricuspid. S1, S2 have been heard, and that's the fourth intercostal space on the left side. And now I'm going to move on to the the fifth intercostal space, the mitral valve, which is medial to the mid clavicle line. S1, S2 have been heard, and I would stay there and listen to the apical pulse for a whole entire minute. All right, patient's pulse was about 72, so that's on the normal range. I'm also going to check the patient's radial pulse. You see in your wrist. And I will listen for 30 seconds, and I can just time it by 2, and that'll give me an accurate pulse. All right, and if I times that by 2, patient's pulse was about 75. I am now going to ask patients, have you had any diarrhea?
No.
Any pain while you move your bowels?
No.
When's the last time you did have a bowel movement?
Today.
Can you tell me the color of your bowel movement?
Brown.
Brown. The size?
Small.
Okay. I'm going to inspect patient's abdomen. I won't palpate until I will palpate after I auscultate. So I'm going to start off with the left lower quadrant. I'll listen for about a minute, but for the purpose of the video, I will not. I'm going to move up to the patient's left upper quadrant. Then I will move over to the patient's right upper quadrant. And I'm going to move down to the patient's right lower quadrant. All right, I heard about 15 clicks, so that is on the normal side. I'm going to, patient's abdomen is flat and I'm in rounds. I'm going to palpate in each abdomen. Check for any distension. There's no distension. Patient's abdomen is tender. When's the last time you urinated?
Today.
Can you tell me the color of your urine?
Clear shell.
Okay. Do you have any pain while you urinated?
No.
No? Okay. All right. That sounds good. I'm gonna move on to patient's, her legs. I'm going to ask, can you please lift up one leg? All right, down. And then can you lift up the other leg? All right. I'm going to check patient's capillary refill in all her toes. There's no clubbing. All right, capillary refill return in about 2 to 3 seconds. I'm going to check patient's pedal pulses. I'll listen for about 30 seconds. All right, patient's pedal pulses is strong and bilateral in both feet, as well as patient's range of motion in her feet. It is strong and bilateral. Patient's skin is fine. There's no cuts, no bruises, no lesions, no abnormalities. And I think patient is A-okay. And that is it for the head to toe assessment. Can you please push on my feet? All right, and I'm going to push on your feet. All right. Patient's strength in her feet is strong and bilateral. I'm going to check for edema. I'm going to start off here, and I would pull up her pants leg, and I would check it all the way up to her kneecap. Do the same in the other. All right, patient had no edema. It was about 2+, so that is perfectly fine.